My journey to natural health care started with my mom. Now, my mom was a nurse. She wasn't a super crunchy nurse or anything like that. She wasn't giving us, herbal tinctures. It was simply that my mom, who was a nurse, knew when I needed to go see a physician and when I didn't. And that's a big weakness in the American people, is nobody really knows, oh, I have this fever. Do I need to go in and see a physician of some sort? And my mom did. So it was very rare that I went to go see a medical doctor because mom usually knew how to take care of me. If there was ever a time where my mom thought, oh, geez, I'm not exactly sure what to do with this, she didn't usually take me to a medical doctor. She would go and take me to our chiropractor, who I've known my entire life. His name was Dr. David Dobson in De Smet. And he was a nutritionist, and he would usually give me some nutritional thing and give me an adjustment as well. And bada bing, bada boom, a day or two later, I'm up and going again. Now, as a high schooler, I started taking anatomy classes, and I thought, this is great. I'm going to become a medical doctor. So I actually went to school for pre-med, but upon self-reflection, I realized, why do I want to be a medical doctor? Other than breaking bones, which I've broken a few, I've never gone to see a medical doctor. Why would I want to be one? And I realized, well, it's mostly just for money and prestige, because our society puts medical doctors on this pedestal. But I personally never went to a medical doctor. I always went the natural route. And a few other things happened. I got married. I worked as a CNA, and so I got a little bit into the medical field with that, and I realized this is not what makes people healthy. Medicine's really, really good at keeping people alive, but it's really bad at helping people live. And so that led me into chiropractic school. And I got out of chiropractic school, and just like anybody gets out of school, you're really kind of clueless. So I continued to do post-grad into nutrition, and then I did some post-grad into acupuncture, and then I did some post-grad into herbal medicine, and there's just so much to herbal medicine. I've barely scratched the surface, and I'm excited to continue learning more about that. So that's where I am. I'm not sure what else to talk about.
I think that's great, yeah.
Okay. I'll add this in, and you can make a video about it if you want.
Yeah.
Here's one thing people don't know. Now, if you go and ask somebody, hey, what's the #1 killer of Americans? A lot of people are going to get it right. They're going to say heart disease. Totally right. Kills a ton of people every year. What's #2? It's the C word, cancer. Cancer is the #2 killer of Americans. But what's #3? Think about it for a sec. What is the 3rd biggest killer of Americans? And this is the one people don't know. People don't know that medical error is the 3rd biggest killer of the American people. Now, this isn't when medical doctors give you something where they know sickness and death is a side effect, like if they're giving you radiation for your cancer. They know death is a side effect of that. This is legitimate, oops, I screwed up, I realized that, and put it in the note. That is the #3 killer of Americans. Medicine is killing 700 Americans today, and another 700 tomorrow, and another 700 the next day. And just to put it in perspective, that's half as many people as died in the Holocaust.